Hi, everyone, and welcome back to the Herflow podcast, a space where we talk honestly about growing up, changing bodies, and everything in between. I'm Saiti Madhavarsu, your host, and today's episode is about one that so many of you have requested, skin. Today we're going to be talking about acne, breakouts, sensitivity, and confidence, and I'm very excited to announce that we'll be going straight to the expert today. Please welcome Dr. Divya Banswada, MD in dermatology who practices in Hyderabad. Dr. Divya has over 10 years of experience treating skin, hair, and nail disorders and works across both clinical and cosmetic dermatology. Her key areas of interest include aesthetic medicine and autoimmune skin conditions, as well as hormonal-related conditions, which makes her perspective especially valuable for teens who are navigating skin changes during puberty. Thank you so much for being here, Dr. Divya.
Hello, Saiti. Hope you're doing good. Thank you so much for having me out here. Hope this podcast and my information really helps the teens out there.
Of course, we really appreciate the time that you've taken for us today. So let's dive right in. To begin, we know that as a lot of girls move from childhood into their teen years, they undergo puberty and a lot of skin changes. So, from your perspective as a dermatologist, what are the biggest changes that you see in skin health at different ages, and why do those changes happen?
Yeah. So, it's like a basic thing, right? When a new baby is born, the baby's skin is going to be very fragile and too thin and too sensitive. And even in the initial couple of days or weeks, the skin keeps shedding and then the actual skin starts growing back, right? So, in the same way, the skin has a cycle of growth. So, it as well as not just grows along with you, but it also exfoliates every now and then, and the kind of skin that you develop around puberty is little bit different. So the initial years of your life, let's say from 0 to 9 years old, the skin
Mhm.
is extra sensitive, which needs extra care, like a lot of moisturization, protecting the barrier, and taking care of the skin, managing it like in a gentle way, right?
Mhm.
So post 9 years, once the hormone starts showing up with the raised estrogen, progesterones, and with the fluctuations in the hormones, the level of the sebaceous secretion increases, which is nothing but the oil glands will start acting like it will start hyperacting. It produces more oils. It
Mhm.
makes skin little bit thicker, and it also gives a better protection, faster healing.
Got it.
So 0 to 9, it needs extra care. From 9 to 18 or 19, the skin goes really crazy. Like you can start expecting a lot of dandruff in your scalp, a lot of acne breakouts, extreme dry skin, too much of reaction to pollution, and the kind of whatever food you start eating, everything starts
Mhm.
showing skin.
Right.
Okay, in around 18 or 19 years, once the hormones settle down, the skin gets to a balance that it has already gotten to the level that it can protect you from the external pollutants, as well as it can also take the absorbed, as well as it can even take the kind of hormonal interruptions that are taking place.
Got it.
So the extremes are going to be from 9. Let's say the 9 is the recent thing, but usually the 11 to 18, the changes happen a lot. And post 18, the skin starts settling down. And again, in the old age, like how the collagen production is not going to happen any further post 30, 35 years, the
Mhm.
skin starts becoming saggy, loose, and very thin. When you look at a 60 or 70-year-old person, because of loss of collagen, the skin becomes very fragile and it doesn't have that elasticity, right?
Yeah.
So how the skin changes from 0 to 100 years.
Wow, that was really great to know. Thank you. And I think what you mentioned about how there's a lot of changes in the skin, especially from 9 years old to 18 years old, is very consistent with what a lot of teen girls see as they experience a lot of acne and changes to the skin and the oil production that you mentioned. So that is a really great big picture of kind of the life cycle, how your skin changes throughout your life.
Yeah.
So, of course, so we talked about these hormonal shifts during puberty, right? So, how exactly do they affect the production of oil and skin sensitivity and acne? A lot of people experience cystic acne. And what are the most common misconceptions that you see among teens when it really comes to acne or bad skin?
Yeah, yeah. So it starts with, let's say, like even once women, once the girl starts attains menarche, those puberty changes, the pre-pubertal changes start appearing like an year before, right?
Mm-hmm.
So the oil production increases in the skin. So basically, why this is happening is around the cycles when you're expecting your menstrual cycle to start commencing, the progesterone levels will go way up and the estrogen levels will withdraw. Okay,
Mm-hmm.
that is where the excess of oil secretion and the sebum secretion starts happening.
Mm-hmm.
Okay, that is the time where there is a need of maintaining your skin.
Mm-hmm.
Uh, it in a proper way, like just a regular hygiene of washing your face one
Right.
two times a day, and just using a basic moisturizer and a sunscreen is all that you need, right? So let's say why the skin goes really crazy around the cycle. So there is a term called catamenial dermatosis. Okay,
Okay.
catamenia is nothing but the hormonal changes, hormonal shift that happens around the menstrual cycle, and because of which the dermatitis is happening. So any pre-existing skin condition,
Mm-hmm.
let's say got severe eczema, atopic dermatitis, psoriasis, or even acne kind of problems, all of this inflammation and all of this severity is going to go way high up because of hyperactivity of progesterone during this time.
Okay.
So during the cycles, this becomes very bad, and again, as the fifth or sixth day crosses, and again the estrogen starts getting back, and the progesterone withdraws, and that time it will start settling down. So
Okay.
that's that you see. Though throughout the month, one may experience acne breakouts. The cystic acne and the painful kind of acne will be mostly there around the cycles only.
Uh,
Yeah, and a lot of people think it's just genetic. Even my mom used to have acne during her teenage, or dad used to have teenage acne and all that.
mm-hmm.
It's that to have acne in teenage is normal,
Mm-hmm.
but there is a way where you need to take an attention, give an attention to it, because definitely acne can be treated. Maybe few kids will just require a basic skincare routine and some basic idea on how to maintain the skin, what is the right product for them to use, and that will actually set the problem. But in few situations, maybe it will become too way too much that they may need little bit more attention of using topical anti-acne medications or oral anti-acne medications based on requirement. So acne is the primary problem, but
Mm-hmm.
the scarring that you develop out of acne is permanent,
Right.
right? So the scars are really going to affect your confidence and later in your life when you have to be more presentable, when you're working on towards like achieving your dreams and all that. So the scars are something that are going to be there with you for life. So the acne that you develop around 12, 13 years, if you can fix it in the initial days, the scarring is not going to be that bad. Okay.
Mm-hmm.
So just fixing to a basic skincare routine and some anti-acne topical medications, following few certain kind of diet, and if required, if there is a need, if you take oral medications and all that,
Mm-hmm.
acne can be controlled.
Got
Yeah,
it.
and
Thank you.
like you also asked, what are the common misconceptions, right?
Mm-hmm.
A lot of kids keep thinking that my skin is too dirty, so I need to keep washing it, and they keep washing it again and again and again and again. So excessive washing of the face actually strips off the natural oil layer from the skin, which makes your skin, just imagine your skin as a brick wall.
Mm-hmm.
Uh, too much of washing, it is removing the protective layer from the skin. So
Right.
when the superficial layer is removed, your skin is becoming more prone to bacteria that you come in contact with, let it be the external pollutants or even little bit of pollen that you get exposed to, even if you're touching your face with the hands and all that, or
Mm-hmm.
during workout also you start breaking out because of the sweat production and all that. So excessive washing the face is not so great. So stick to washing your face maybe 2 times a day with the face wash, and the remaining times, if you feel you're sweating too much or something, you can just do water wash, but don't use the cleanser every single time.
Got it. I think that's very helpful information because I definitely know that a lot of people default to just washing their face when they feel dirty or sweaty, but really knowing that two cleanses a day is what's healthy for you, I think is really essential information, especially for those who, like you said, work out and sweat, or they just feel that like their face is too dirty. Just a simple, water rinse might be good. And then you also mentioned how the changes in estrogen and progesterone levels during menstruation can cause what we see as cystic acne, or just the flare in acne during or near menstruation. So that really offers a big explanation for a lot of the young women who are experiencing these patterns. And then the advice of using that, just any acne medication or taking care of your acne when it comes up, can prevent scarring in the long run, which is really important to know, because sometimes it's not just saying, "Oh, it'll go away." You should take action when you have time. So I think that's really great advice. So kind of following up around the acne aspect of it, I know we mentioned cystic acne, but I'm just curious to know, we kind of generalize acne under this umbrella of just the different, bumps on your faces, right? So do you think you could delve a little deeper into what the different kind of acne is, and how you can differentiate between the different types of acne, and maybe what should be treated, what you can just leave, and the different methods of approaching the different types of acne?
Yeah, that's a good question, Saiti. So, going deep into it, like there is a different grading that is available. There is different grading for acne, right? So, grade one to grade four, grade one being the milder and the grade four being the severe form.
Mm-hmm.
So, when somebody comes to me, or for that, any dermatologist, if it is around grade one and grade two,
Mm-hmm.
we restrict giving topical treatment, help them with anti-acne medications like just an antibiotics like clindamycin or minocycline kind of ointments, or a tretinoin if there is a need, and all that. So just applying this kind of ointments will actually reduce the initial inflammation that is. So grade one will be something. Uh, yeah, grade one acne is. Grade 1 acne is typically like a comedonal acne, where it is just going to be like a little bit blockage of the sweat duct, and that has led to, right? But when this sweat duct that is blocked and it is not coming down, the inflammation keeps happening and the sebum keeps producing in it. That will
Mm-hmm.
lead to grade 3 or grade 4 cystic acne. Okay,
Right.
so grade one and two can be treated with topical antibiotic ointments or anti-acne medications.
Mm-hmm.
Once it goes to grade three or grade four, which are like a fully grown bacterial acne, that needs attention, that needs oral medications to reduce the inflammation,
Okay.
right? So grade four is the cystic acne. Sometimes even if the oral medications like just anti-acne antibiotics are not working, maybe if there is a need for few certain teenagers, we also put them on oral medications like a little bit. If it is hormonal acne, let's say, the positioning of the face also actually makes a lot of difference. So
Mm-hmm.
if consistently developing more acne on the lower part of the face, that actually gives us a warning sign about their menstrual cycle. If there is any abnormality with the hormones, if there is too much fluctuations of the hormones and all that, it breaks out in that way.
Mm-hmm.
And an unmaintained, little bit more ignored kind of skin, the acne will be like more on the face, and just hold on. Huh?
Hello.
Yeah, so I'm back again. Yeah, like I told you, like in case if the oral medications, if there is a need, we'll also put them on oral medications when it's the
Mm-hmm.
severe. Like I told you, scarring is the secondary result, like the healing part of the acne part thing, right?
Mm-hmm.
So when it develops proper grade 3, grade 4 scars, it becomes a cure the scars. Okay, the scars are never going to be gone 100%, and as you age, it is going to become more evident. So to avoid that level of scarring, there is a definite need of consulting a doctor if the acne is consistently happening, and if it is not reducing with any basic changes in the skincare routine, or with any topical antibiotic ointments as well.
Got it. Thank you. That's really interesting to know that the acne is kind of evaluated on this scale. So you said grade 1 through 4 is more of, or 1 through 2 is more of when your sweat glands are blocked and you experience a little less severe acne. And then grades 3 and 4 is when it's especially important to consult a healthcare professional like yourself. And that's when you kind of see that cystic acne or bacterial acne that also arises near menstruation, and that's when you may take some oral medication to prevent the scarring. So I'm just sorry, just to kind of follow up with the scarring again. I'm just curious to know for people who already have scars, right? Because we have a lot of listeners who are in their later teens who kind of have scars from acne from when they initially began menstruating, or just when they first went through puberty around 11, 12 years old. um, how can they kind of work with the scars that they have right now? Is there any way to kind of help them fade, or anything that you suggest, or any experience that you have around scarring?
Yeah. So one thing first I want to clear is a lot of teenagers or patients come to me and ask, Doctor, I've got scars and I want to get rid of them. So the scars for a doctor's term is the kind of depressions that you develop post acne. That
Mm-hmm.
means loss of tissue underneath the skin, so which leads to kind of a depressive scars on the skin. But a lot of people refer the scars as a hyperpigmentation, that is a dark mark that you that remains after the acne breakout.
Yes.
So if the dark mark, that is a concern for whoever is looking for. So the kind of marks that you develop post acne breakouts, even if it is left untreated, after 6 to 9 months maximum, each and every scar that you have out of any acne mark will eventually fade away,
Mm-hmm.
because it keeps exfoliating every third, fourth week, right?
Mm-hmm.
So multiple cycles of skin exfoliation happens, the deeper the older scars will become lighter, the marks, I mean to say. So when
Right.
it comes to acne scars, though again, acne scars are also classified into different levels. So we call it as ice pick scars, which are just a tiny holes but which are deep into the skin, or box scars, which are proper kind of box shaped scars, which has a
Mm-hmm.
proper and with too much of depth of loss of the tissue. So this kind of scars are there. So somebody who has already developed acne scars, treating them at younger ages are always better, because treating the acne scars post 30, where the collagen is not naturally producing, the result might not be that great. Definitely we can
Right.
still do, but in the earlier age, maybe 22, 23, if we can start doing micro needling radio frequency treatment or carbon dioxide laser,
Mm-hmm.
which acts in breaking down the existing previous old collagen, and it stimulates the new collagen production. So once the new collagen production starts developing, so in a scar, what exactly happens is there is loss of tissue underneath the skin.
Mm-hmm.
So how a scar appears, right? An acne scar, it is like this kind of a
So like a
deep.
depression.
So once we do couple of sessions of, let's say, 6 sessions or 8 sessions, in each and every session, the scars, we are kind of breaking down the tissue that is adherent to the skin. So there is some tissue that is pulling down the scar downwards. That
Mm-hmm.
is a is forming a kind of a loop underneath. So
Oh.
microneedling treatment, the microneedling device typically breaks down the tissue underneath. It removes the collagen adhesions. So the new collagen forms, and slowly, slowly, the depth of the scar reduces.
Oh, wow.
So it kind of raises onto the skin. The skin becomes tighter.
Mm-hmm.
The pores also becomes like tighter, and it kind of gets closed or something like that.
Mm-hmm.
So all that we do in microneedling is boost the collagen production, which helps in reducing the acne scars.
Oh wow. So that's really fascinating to know the
Hmm.
technology that's around to treat scars. So the way what you mentioned about the microneedling, the way that it's able to, undo the depression that's existing in the skin by boosting the collagen production. That is really, really exciting technology. And it's constantly really impressive to see how quickly the technology is evolving in medicine. So that is really cool. So thank you for telling us one of the treatments that's available for people with existing scars. And then also keep in mind that just because you can treat the scars that you have, you should still be aware of treating acne as it comes. So everyone should be very aware of preventive strategies. And then, of course, if you do have existing scars that you want to heal, the microneedling treatment and the laser treatment is always an option later in the future. So, you did mention a couple times about the different skincare routines. You know, we discussed cleansing your face twice a day, and then using some topical acne cream to treat acne. So, in your perspective as such an experienced dermatologist, if you had to pick one ideal skincare routine specifically for teen girls, what would it be? So, in context, what products would you suggest teen girls should use in an ideal day-to-day basis? How much should they use of it? And then what should the just ideal morning and nighttime skincare routine look like? Or if there's anything that we should do in the middle of the day as well.
Done. Starting off with somebody with like a sensitive, dry skin, not much acne or oily prone skin. Starting off with that, start off with a gentle cleanser and
Mm-hmm.
top of a hydrating moisturizer. So among teens, I would say we don't know who really has that acne breakout kind of acne tendency and who doesn't have it. So I would say post 9 or 10 years of age, start using a proper non-comedogenic moisturizer which is light in weight. Okay. Based on the seasons also, you'll again have to change the products. At least start off with a non-comedogenic product. So always look for a moisturizer which is particularly made for the face moisturizing and which is non-comedogenic or does not or has a label saying it does not clog the pores.
Mm-hmm.
Okay, pick such kind of moisturizer and follow it up with a mineral sunscreen. So typically using a mineral or a physical sunscreen is best for up to 14 to 15 years of age because the chemical sunscreens are really not recommended among the kids
Mm-hmm.
of years age because it can cause hormonal disruption. Nothing is proven, but it is better to be stay on the safer side, right? So only pick the mineral or physical sunscreen.
Mm-hmm.
Mineral physical sunscreen, one drawback with that is it kind of settles only on the skin. It's not getting absorbed into the skin, right?
Mm-hmm.
Which actually gives it is not so aesthetically comfortable.
Right, right.
So it either leaves a white cast or it looks like a paint that you have applied on face and all that.
Mm-hmm.
But the proper way of applying it is after doing a gentle cleansing, apply adequate quantity of moisturizer and
Mm-hmm.
over the apply the sunscreen, the required amount, and stay indoors only for the next 20 to 30 minutes, and then you can step out of the house. Meanwhile, this time the sunscreen settles down into the skin, and that it will stop showing that white cast or it stops dripping off because of the sweat.
Uh,
Okay, this is for the morning routine.
mm-hmm.
And somebody who has acne prone skin, and if the acne breakouts are too often, maybe you can pick like a benzoyl peroxide based face wash with a milder percentage, like which are over the counter,
Mm-hmm.
or a acid based face wash. This is for kids over 12, 13 years, not too young than that.
Right.
Uh, Pick that and use it once in a day, maybe after school, because that helps in removing the pollutants from your school ground and all that.
Yes.
So again, for them also, it is just a plain lightweight moisturizer. Follow it up with a physical sunscreen. This is all for the morning routine that you would need. And in the night routine, if the acne is too much, you can start using clindamycin kind of over-the-counter anti-acne gels, which
Mm-hmm.
are just a spot treatment
Right, right.
on the active acne in the morning and night two times,
Mm-hmm.
which using the inflammation, it also kills the bacteria. Uh, in case if it is too bad, like I told you, when you need to consult the doctor, the doctor will put you on the low dose topical steroids like adapalene or tretinoin, which
Mm-hmm.
will using the acne breakouts too. So in case if you're put on topical adapalene or benzoyl peroxide kind of gels, which are little bit photosensitive, which reacts to the light, they
Mm-hmm.
are applied only in the night time and not during the daytime. Okay, that is again a topical treatment only on the active acne. Just leave
Mm-hmm.
it on an hour or 1 hour. Or if it is less percentage, you can leave it through the night, or after half an hour, you can layer it with a moisturizer and go to bed.
Right.
So, as a teenagers, I would say don't add any actives in your routine, don't add any serums, nothing else is required. Just a gentle cleanser, moisturizer, and sunscreen is perfect for your age.
Awesome. Thank you so much for that routine. I think that is extremely insightful, especially because I know that a lot of, you hear about like the TikTok advice or, just influence around the friends. I know that a lot of teens resort to, like you said, the serums and like retinol, vitamin C. So I think it's a very refreshing perspective from a dermatologist that even if you do have extreme like flare ups and acne and all that, really all you need is a good face wash with benzoyl peroxide or salicylic acid, is what you said, once a day. And then, if needed, you can use treatment like the benzoyl peroxide treatment. And then, of course, with the sunscreen, that was amazing advice to stay indoors for 20 to 30 minutes after putting on the sunscreen because there are a lot of teens who may avoid that step in their skincare process, avoid sunscreen because, like you said, it's not the most aesthetically pleasing. It does sometimes leave a white cast or feel uncomfortable. So I think the advice of staying indoors a little bit to allow the sunscreen to settle will avoid any streaks from sweating and decrease the negative look of the sunscreen. So that was amazing advice. Thank you so much. One last question I do have is, do you think it is okay to cleanse your face in the shower? Because I know that a lot of people, it's a controversial subject in a lot of conversations. Can you cleanse your face in the shower or not?
Yeah, see, if you are cleansing your face in the shower, it has to be a gentle cleanser.
Mm-hmm.
Okay, you are using any actives like salicylic acid face wash or a benzoyl peroxide face wash, and you're using the same face wash, apart from the 10 times cleansing your face and again in the shower another 2 times, that becomes of too much of exfoliating your skin.
Right.
So removes the protective oil layer, and it makes your skin more dry and it makes it more and more sensitive. So
Mm-hmm.
cleansing your face in the shower with the actives, maybe you can use like a gentle face wash or like a kind of a just a hydrating cleanser. You can use that. So
Mm-hmm.
if that, then maybe you can switch to just 2 to 3 times a day of cleansing the face is good enough.
Right.
Not
Awesome. Thank you. Thank you so much for your time, Dr. Divya. And to wrap it up, I have one last question for you. If you could give one piece of advice or one takeaway that you wanted all teens to have from this episode of Her Flow, what would it be regarding skin and just maintaining good habits when it comes to your skin?
yeah. So all the teenagers, like for that matter, almost every girl goes through this phase. Like around this time, this is the time where you are also having the academic pressure because of the hormones. You'll start having a lot of stress related to the studies. At the same time, your hormones and the skin starts going crazy. You might see a lot of dandruff in the scalp, so much dirty skin, like a lot of acne breakouts, and too much oily skin, which
Right.
you're not comfortable with, and all of this actually just happens in 3 months or 6 months of time. So a lot of kids go through like kind of a depressive phase, that they stop becoming going out, not socialize and all that. But hang in there, everybody must have going through that phase. And you have to just just give it some time, try to fix it, take your parents help, go consult a doctor if it is too much. Or if nothing is working for you, just don't follow any random TikTok or Instagram videos or influencers videos.
Yeah.
Don't start too many actives on your face before 15 years of age. No retinol, no vitamin C, nothing is required below 15 years of age. So just stick to a basic skincare routine. clean eating and good sleep, good night sleep is very equally important. If
Mm-hmm.
your sleep is disturbed and if you're taking munching on too much of junk food, oily food, sugars, definitely all of this again increases the size of the sweat gland and again it leads to the acne breakouts. So just a clean eating, good night sleep, and balance diet will really help in combating all these problems that you go through in the teenage.
Of course. Thank you so much, Dr. Divya. And this is a recurring theme that we've seen through the Hurtful episodes while talking to different healthcare professionals is that balance is key. So everyone, please keep that in mind. And like Dr. Divya said, you're not alone in what you're going through. Everyone has gone through that phase of acne and flare-ups. So please know that we are all standing with you. And if you do need support, please do visit a healthcare professional or dermatologist for consultations. Dr. Divya, thank you so much for breaking this down in such a clear and honest way. Your transparency was incredibly helpful. And to everyone listening, your skin is not a measure of your worth or maturity or beauty. It's just another part of your body, and it's learning how to grow as you grow. So just, learn to love it and learn to embrace it. I hope you enjoyed this episode. Make sure to follow her flow, and we'll see you next time. Thank you so much. Bye.
Thank you.